Why India is badly struck COVID-19, when they produce more vaccine than any other country. India's COVID situation. India is suffering the worst COVID crisis so far, and the government negligence might be the biggest factor in creating the situation. The second wave of coronavirus has come hard on Indians. Raging through the population, the infection is carried by 3 different highly contagious mutants of the original virus, namely, the UK variant, the South African variant, and the highly contagious Indian variant. Previously claiming to have beaten the virus by bringing the number of new cases down to 11,000 per day across the country, the Indian government loosened the restrictions and allowed mass public gatherings earlier this year. These stats were already questionable, and the rest of the truth was unveiled when we saw a sudden surge in the number of infections and rising death toll across the nation in a matter of weeks. Just last week, India recorded a staggering 349,691 new cases of COVID-19 in a day, which is the highest number of coronavirus-positive cases recorded in a day anywhere throughout the course of pandemic. The number of deaths per day also climbed up to its highest at 2,767 fatalities in 24 hours on Saturday last week. Indian Ministry of Health. Overall, the stats are getting grimmer each day, with an overall number of infections recorded, crossing 17 million nationwide, with a death toll of an appalling 190,000 and rising. The Indian authorities, especially health infrastructure, are facing crippling pressure. Just over the last week, India has reported over 1 million new cases of infection. In the capital city Delhi only, the virus is killing 1 person every 4 minutes. Only under 2% of the total 1.4 billion people living in India have been vaccinated so far, despite the fact that India is currently among the biggest producers of COVID-19 vaccine globally. Nonetheless, investigative evidence dominantly shows that the number of new infections as well as deaths is appallingly downplayed by the authorities. Which is one of the reasons why the crisis could not be stopped before getting worse to the point that we are seeing right now, and also why the disease control measures are falling short to stabilize the number of cases, and control further spread. At this point, every second person being tested is COVID positive, and epidemiologists in India are saying that the actual number of deaths and new infections are likely 2 to 5 times larger than what is being reported. The New York Times. The already weak healthcare infrastructure in India is facing an overwhelming short supply of critical medications, oxygen cylinders, ventilators, and even medical staff. People have to wait in lines outside the hospitals to even get a chance to see a doctor, while COVID wards as well as emergency wards are full, and patients desperately gasp for air, on the roads, in the parking lots, outside health facilities. Families of the patients are forced to find oxygen supplies on their own, as hospital authorities fall short to help. Al Jazeera Network, BBC, DW, NDTV India. Crematories are overwhelmed with ever-spiking number of funerals, following breathless deaths caused by the COVID infections, and have been directed to operate overnight, to accommodate the surge in death toll. And over the last week, heart-wrenching spectacles of people cremating and performing the last rites of their loved ones in the parking lots, several at a time, have been seen in Delhi and in other parts of the country. The variant virus strains have dominantly set on to claiming younger lives too, contrary to the relatively weaker strains at the beginning of the pandemic, which mostly caused deaths in older and weaker people. BBC, DW, atop of that, hospitals are refusing to take in those patients, who already have reached the critical phase. The entire situation in India right now is the real-life manifestation of all those concerns and eventualities that healthcare experts put forward at the onset of pandemic, given that strict measures to control the spread of disease were not taken. Healthcare facilities are pushed to discriminate between the patients based on treatability stage of infection, and people who could afford, are going for private hospitals. What went wrong? The biggest responsibility of this dire situation is imputed to the Indian government and state authorities, who have been misinforming the true severity of the disease, and downplaying its impact. The international community has shown serious concern over the health crisis underway in India, and countries like UK and US have dispatched aid in critical medical supplies to help. However, the Indian-owned government failed to secure its citizens from the foreseeable horrors of this pandemic, while being almost self-sufficient in their vaccine supply. You see, India is the fourth biggest supplier of COVID-19 vaccine at the time, and still only less than 2% of its total population is inoculated with the vaccine. The rest of the population are stood on waiting as India puts a greater emphasis on exporting the major percentage of vaccine around the world. Another unfortunate reason for the eventualities that India is facing right now is the lack of control measures and restrictions, and utter disregard for COVID SOPs, coming from the downplaying of the real devastation caused by the disease, and the compliance and apathy of the local Indian media towards government negligence. Government eased the restrictions on movement and gathering earlier this year, claiming that the spread of disease had been successfully under control. The mass political gatherings and rallies sanctioned by the government have been held throughout past few months in the wake of 5 state elections. Millions of people turned out to vote for their representatives in the state of West Bengal on Monday, the 26th of April 2021. 4 other states have held their state elections through the month of April, and are reckoned as one of the biggest agent in accelerating the spread of disease. The Madras High Court also held the Election Commission of India responsible single-handedly for the wild spread of infection in the second wave of coronavirus pandemic. Moreover, religious festivals and large gatherings were not only allowed, but in fact encouraged by authorities in some parts of the country. Nonetheless, with increase in the voices of concern raised by the international community, the WHO as well as some dissenting, non-complacent voices in the Indian media, the India government has mobilized its resources to control the situation, abetted by the aid from around the world. The government has also recently called on to the Indian armed forces to help deal with the crisis and control the situation. This brings us to the end of this video. Thank you for watching. Let us know of your feedback in the comments below. Don't forget to like and share this video if you liked it. And take a moment to subscribe to our channel for more interesting stuff. It means a lot to us. Bye.